Another day, another story. Hello, everyone. Welcome to our channel, where we will show you how to travel with diabetes and what to pack in your diabetes kit. Whether you are planning a short trip or a long vacation, these tips will help you stay healthy and safe while having fun. In this video, we will share with you some tips on how to travel with diabetes and what to pack in your diabetes kit. These tips are based on the recommendations from the Centers for Disease Control and Prevention, CDC, the Diabetes Disaster Response Coalition, and other reliable sources. So, without further ado, let's get started. See your doctor before you travel. Before you book your trip, make sure you see your doctor and get a medical checkup. Your doctor can help you adjust your medication, diet, and exercise plan according to your destination and travel schedule. Your doctor can also give you a letter and a prescription that explain your condition, your treatment, and your medical supplies. This can help you avoid any problems with security or customs at the airport or border. Plan ahead for your insulin and supplies. If you use insulin or other injectable medications, you need to plan ahead for how to store and use them during your trip. You can use an insulated bag, a cooler, or a thermos to protect your insulin from extreme temperatures. You can also ask your hotel or host if they have a refrigerator where you can store your insulin. You also need to pack enough insulin and supplies for your trip, plus some extra in case of emergencies. You should pack at least twice as much as you think you will need, and keep them in different places in case one gets lost or damaged. You should also pack some snacks, glucose tablets, or juice boxes to treat low blood sugar if it happens. Wear a medical ID. Wearing a medical ID bracelet or necklace can help others identify you as a person with diabetes in case of an emergency. It can also alert him to any allergies or special needs you may have. You can get a medical ID from various sources online or offline. Monitor your blood sugar. Traveling can affect your blood sugar levels in different ways. Changes in time zones, food, activity, stress, and altitude can all impact how your body responds to insulin and other medications. That's why you need to monitor your blood sugar more often than usual when you travel, especially before and after meals, before and after exercise, before bedtime, and whenever you feel unwell. You may also need to adjust your medication dosage according to your blood sugar readings and your travel plans. For example, if you are traveling across time zones, you may need to change the timing of your injections or pills to avoid taking them too close together or too far apart. You should consult with your doctor before you travel about how to do this safely. Be careful with what you eat and drink. One of the joys of traveling is trying new foods and drinks from different cultures. However, as a person with diabetes, you need to be careful with what you eat and drink to avoid any complications. You should follow these general guidelines. Choose foods that are low in fat, salt, and sugar, and high in fiber, protein, and vitamins. Avoid foods that are fried, greasy, spicy, or unfamiliar to you. Limit your intake of alcohol, caffeine, and carbonated drinks. Drink plenty of water to stay hydrated. Carry some snacks with you in case you get hungry or have low blood sugar. Check the nutrition labels or ask for the ingredients of the foods and drinks you consume. Stay active but don't overdo it. Exercise is good for your health and well-being, especially when you have diabetes. It can help lower your blood sugar levels, improve your mood, and reduce stress. However, you should not overdo it when you travel. You should follow these general guidelines. Check with your doctor before you start any new physical activity or sport. Choose activities that are suitable for your fitness level and health condition. Warm up before and cool down after each session. Wear comfortable shoes and clothes that protect you from the sun, heat, cold, or rain. Drink water before, during, and after exercise. Monitor your blood sugar before and after exercise, and adjust your medication if needed. Stop and rest if you feel dizzy, nauseous, or unwell. Know what to do in case of an emergency. Even if you follow all the tips, you may still encounter some problems or emergencies when traveling with diabetes. You should know what to do in case of an emergency, such as low blood sugar. This can happen if you take too much insulin or medication, skip a meal, exercise too much, or drink alcohol. Symptoms include sweating, shaking, hunger, headache, confusion, or loss of consciousness. To treat low blood sugar, you should eat or drink something that contains fast-acting sugar, such as glucose tablets, juice, candy, or soda. Then check your blood sugar again after 15 minutes and repeat the treatment if needed. If you are unconscious or unable to swallow, someone else should inject you with glucagon or call for medical help. High blood sugar. This can happen if you take too little insulin or medication, eat too much, get sick, or experience stress. Symptoms include thirst, frequent urination, dry mouth, blurred vision, fatigue, or nausea. To treat high blood sugar, you should check your blood sugar and ketones. If you have a meter, take extra insulin or medication as prescribed by your doctor, drink water to flush out the excess sugar, and seek medical help if your condition does not improve or worsens. Diabetic ketoacidosis, DKA. This is a serious complication that can occur when your body does not have enough insulin and starts breaking down fat for energy. This produces ketones, which are acidic substances that can build up in your blood and urine. Symptoms include nausea, vomiting, abdominal pain, fruity breath odor, rapid breathing, or coma. DKA can be life-threatening and requires immediate medical attention. To prevent DKA, you should check your blood sugar and ketones regularly, take your insulin and medication as prescribed by your doctor, and avoid dehydration and infection. We hope these tips will help you travel with diabetes and enjoy your trips without any worries. If you have any questions or comments, please leave them below. And don't forget to like and subscribe to this channel for more videos on diabetes and health. Thank you for watching and have a great day.